In today's video, we will explore the field of vertebral augmentation techniques. Our focus will be on vertebroplasty and kyphoplasty, which have brought significant pain relief and improved quality of life for patients with vertebral compression fractures. We will cover fracture classification, cement delivery techniques, imaging modalities, patient selection, complications, pre-procedural planning, adjunctive therapies, anesthetic considerations, outcomes comparison, cost-effectiveness analysis, management of recurrent fractures, and emerging technologies. Let's dive into this captivating field. Fracture classification plays a crucial role in determining the appropriate treatment strategy for vertebral compression fractures. Two widely used systems are the Gennett and AU classifications. The Gennett system categorizes fractures based on the severity of vertebral body collapse as mild, moderate, or severe. On the other hand, the AU classification system classifies fractures according to their morphology, considering factors such as fracture location and type. Having a standardized classification system aids in communication between healthcare professionals and helps guide treatment decisions. During vertebroplasty and kyphoplasty, the delivery of bone cement is a critical step. Various techniques can be employed, including the unipedicular and bipedicular approaches. In the unipedicular technique, a single needle is inserted into the fractured vertebral body, whereas the bipedicular approach involves the placement of two needles. Each technique has its advantages and drawbacks, and the choice depends on factors such as fracture type, location, and operator experience. Proper cement delivery techniques are essential to ensure optimal dispersion and distribution within the fractured vertebral body. In order to choose the right treatment for vertebral fractures, accurate diagnosis is essential. X-ray, CT, and MRI are commonly used to provide initial screening and detailed information about the fracture's morphology, associated complications, and underlying pathology. A combination of these imaging modalities ensures accurate diagnosis and treatment planning. Selecting the appropriate patients for vertebroplasty and kyphoplasty is crucial for achieving favorable outcomes. Generally, patients with symptomatic vertebral compression fractures refractory to conservative management are considered for these procedures. Factors such as the quality of bone, fracture age, spinal stability, presence of neurological deficits, and patient comorbidities play decisive roles in patient selection. Evaluating both clinical and imaging parameters helps identify suitable candidates who are likely to benefit from vertebral augmentation. While vertebroplasty and kyphoplasty are generally safe procedures, complications can occur, with cement leakage being the most common. Cement extravasation into the paravertebral veins, spinal canal, or surrounding soft tissues can lead to various complications, including nerve root irritation, pulmonary embolism, and vertebral artery injury. Timely recognition and proper management of cement leakages are essential. Techniques such as balloon occlusion and cavity creation can be employed to minimize the risk of cement migration and improve patient safety. Thorough pre-procedural planning and assessment are crucial for successful vertebral augmentation. This includes a detailed patient history, physical examination, and assessment of imaging studies. Understanding the fracture characteristics, spinal alignment, and neighboring anatomy allows for accurate procedural planning. Preparing the patient psychologically and counseling them regarding the procedure's benefits, risks, and potential complications are also essential aspects of the pre-procedural assessment. In addition to vertebroplasty and kyphoplasty, several adjunctive therapies can enhance the management of vertebral compression fractures. These include oral analgesics, physical therapy, bracing, and spinal orthoses. Calcium and vitamin D supplementation play a crucial role in improving bone health and reducing the risk of future fractures. Additionally, the use of orthobiologics, such as bone morphogenetic proteins and mesenchymal stem cells, is an emerging field that holds promising potential for enhancing fracture healing and overall outcomes. Choosing the appropriate anesthesia technique is crucial for patient comfort and procedural success during vertebroplasty and kyphoplasty. Options include general anesthesia, monitored anesthesia care, and local anesthesia supplemented by conscious sedation. Factors such as patient preference, overall health status, and procedural complexity influence the choice of anesthesia. Collaborative decision-making between the anesthesiologist and the interventional radiologist ensures patient safety and optimal procedural conditions. Vertebroplasty and kyphoplasty are both effective techniques, but they differ in certain aspects. Vertebroplasty involves the direct injection of cement into the fractured vertebra, while kyphoplasty involves inflatable balloons to restore vertebral height before cement injection. Kyphoplasty has the advantage of potential vertebral height restoration and better mechanical support, leading to a decreased risk of adjacent level fractures. Outcomes in terms of pain relief, functional improvement, and quality of life measures have been extensively studied, with several meta-analyses suggesting comparable results between the two techniques. As with any healthcare intervention, cost-effectiveness is an important consideration. Multiple studies have evaluated the economic impact of vertebroplasty and kyphoplasty, considering factors such as procedure costs, subsequent healthcare resource utilization, and quality-adjusted life years gained. While upfront costs may be higher for kyphoplasty, long-term costs can be influenced by factors such as reduced fracture-related hospitalizations and improved patient outcomes. Cost-effectiveness analyses help guide healthcare decision-makers in allocating resources appropriately. In some cases, patients may experience recurrent fractures following previous vertebral augmentation procedures. Several factors contribute to recurrent fractures, including adjacent level fractures, ongoing osteoporosis, poor cement distribution, and technical factors. Managing recurrent fractures requires a comprehensive evaluation of the underlying causes and appropriate treatment planning. A multidisciplinary approach involving interventional radiologists, orthopedic surgeons, and endocrinologists is essential to optimize outcomes in such scenarios. Advancements in technology continue to shape the field of vertebral augmentation. Novel techniques, such as radiofrequency ablation and cryoablation, show promise in the treatment of vertebral fractures. Additionally, the development of biodegradable or osteoconductive bone cements holds potential for improving long-term outcomes. The integration of artificial intelligence and machine learning algorithms in decision-making and procedural planning may further enhance the precision and accuracy of vertebral augmentation procedures. Ongoing research and innovation in this field are exciting and provide hope for the future management of vertebral compression fractures. In summary, vertebroplasty and kyphoplasty are effective treatments for vertebral compression fractures. With proper knowledge of fracture classification, cement delivery techniques, imaging modalities, patient selection, complications management, and emerging technologies, healthcare professionals can provide optimal care. Research and advancements will continue to enhance patient outcomes.